Hi, I'm Kate Lackey, and today I'm going to discuss why I feel rural and remote education is an essential component of health professionals' education. Rural and remote content is an essential component of health professionals' education. A large portion of the population resides in rural and remote communities, and traditional healthcare education occurs in urban practice settings. This presentation will argue that remote and rural education is essential to improve the rural workforce, facilitate an understanding of rural and remote specific barriers, and increase competence of healthcare providers who choose to work in these practice settings. Rural and remote healthcare provider education in its current state. Currently, despite the unique challenges experienced by patients in remote and rural communities, many healthcare provider education continues to occur in urban settings. Placements are often at tertiary teaching facilities, so limited exposure in rural settings often occurs. And this lack of specialized skills learned in healthcare education leaves new graduates ill equipped to practice in rural and remote settings. First, it is important to get an understanding of what rural and remote care is. We are going to look at some definitions. The definition of rural communities is usually considered for populations that have less than 20,000 people and limited access to inpatient and specialized services. Alternatively, the definition of remote community means that it is often isolated geographically but also socially. Indigenous communities can often fall within this definition, and we have many of those in Canada. I will note that the Indigenous community prefers the terminology to be Inuit Ninungut to respect the language and culture of these regions. Rural and remote healthcare background information. Rural and remote communities in Canada face unique healthcare challenges, including physician and staff shortages, resource limitations, and funding constraints. 18% of the Canadian population live in rural or remote communities, which makes up a significant portion of the population in this country. Only 8% of physicians in Canada serve this population. Due to Canada's large geographical size, the population is quite spread out, which creates many rural and remote communities. Canadians living in rural and remote communities often have poorer health outcomes, are older in age, and less financially secure than the rest of the population. These Canadians have to travel further to access healthcare, and healthcare providers don't have the access to the same tests and specialists that their urban counterparts do. Rural and remote content is essential. Rural and remote content in health professionals' education is essential to ensure patients receive access to safe and equitable care. It promotes early recognition and identification of deterioration, which is essential in advocating for specialized services. Rural and remote specific education improves advocacy skills and the ability to work autonomously to provide patients with the best possible care. These experiences give students a realistic expectation of what rural and remote healthcare practice is, and this will increase their confidence, and ultimately staff retention will improve and the rural and remote workforces will be stronger. Rural and remote content in healthcare providers' education will have workforce improvements. It will improve recruitment, retention, and preparedness. Research has continually shown that clinical placements in rural and remote communities improves recruitment and retention in these practice settings. Rural and remote education develops realistic expectations of what rural healthcare actually is. While the increased scope and autonomy can be rewarding, many healthcare providers cannot fully understand what it is like working in a setting where you cannot easily page a specialist or may not even have a physician accessible to you for a lengthy period of time. This reality shock can deter new providers from continuing to work in these settings. Rural and remote student education, specifically clinical placements, allow students to fully understand the expanded scope required to work in rural and remote healthcare. Clinical placements allow students to gain firsthand exposure to the autonomy that they will have working in these communities. Confidence and communication skills are able to be developed as they have no choice but to become great communicators with members of the interdisciplinary team as they need to be effective advocates for their patients. To illustrate this, I will give an example of what a rural consolidation for a nursing student might look like. A student can be placed in a rural labor and delivery unit. The obstetricians do not stay in hospital, so the new nurse must develop strong assessment skills and an ability to communicate their findings and concerns. When they are concerned about their patients, they have to communicate very well to ensure that they receive the care that they need in a timely manner. Next, I will demonstrate how rural and remote content in health providers' education helps to improve critical thinking skills by navigating a practice setting where there are limited resources. Education in rural and remote practice settings helps students recognize barriers and how these areas function from urban practice settings. Many rural and remote communities are far from specialized care, so providers need to become resourceful to ensure patients have access to the care that they need. Without rural and remote specific education, new providers may not be prepared to provide safe and effective care when resources are limited. An example of this would be learning how to ensure patients can access specialized care by using technologies such as telemedicine, especially if transferring a patient for care isn't reasonable. Rural and remote placements help students learn how to adapt a plan of care for their patients based on what resources are available to them. Because it isn't always easy to transfer acutely ill patients into tertiary care centers, providers need to manage sick patients for longer with a lack of resources. Often the tertiary centers have capacity issues, so can only accept transfers once patients get to a certain threshold of acuity. For example, a patient with slowly decompensating pneumonia will need to be managed rurally until they can be transferred. In situations such as these, providers need to be resourceful to be able to manage these patients and initiate interventions to ensure their patients receive the best possible care. And finally, rural and remote content in healthcare providers' education will improve confidence and competence. This type of education will improve clinical competence by providing exposure to a wider variety of patient conditions with fewer resources. Students need to become adaptable and resourceful, which helps develop a broad skill set caring for a wide range of illnesses with patients who statistically have poorer health. These experiences help teach problem solving and critical thinking skills that cannot be replicated in settings where resources are readily available to them. A study by Hepburn et al. In 2024 reported that rural students experienced improvement in clinical reasoning and confidence. They also indicated that rural placements provided greater opportunities to develop clinical skills. Confidence is built from managing patient situations independently or with little support. Providers prove to themselves that they are capable of handling tough situations with little support. Anxiety and uncertainty is also improved as exposure in their education decreases stress as they are entering into the rural or remote workforce after graduation. New providers can have difficulty navigating the workforce when they don't know the realities of the rural setting. For example, some rural organizations only have one physician for the whole entire hospital. If that physician is managing an emergency on one unit, the nurse may need to manage their decompensating patient with little support until they are available. Without ever experiencing this reality, feelings of anxiety and uncertainty can develop. And now for some closing thoughts on why it is essential that rural and remote content is in all healthcare providers' education. Rural and remote content in health providers' education shouldn't just be a consideration, it should be an expectation. Education in urban settings cannot replicate the unique experiences gained from practicing in underserviced and under-resourced communities. Education specific to these practice settings encourage future providers to be competent and effectively navigate a setting that has limited resources and broad scopes of practices. It is not hard to provide rural placements, as traveling just outside of urban areas provides a completely different hospital experience. Rural and remote specific education is essential that we ensure to train a competent, confident, and sustainable workforce that serves almost one-fifth of our Canadian population. This is slide 1 of references utilized to create this presentation. This is slide 2 of references utilized to create this presentation.